Hello, everybody, and welcome back to The Confidential, the Health Edition. I have a very important guest for you today. This is going to be a very educational session, a very educational episode. I have Dr. Albert Osei. He is a PhD, very, very intelligent individual, and also the clinical director from the Vaughan Center for Autism. He is an autism treatment specialist. And I really wanted to bring this to the audience because I understand that a lot of parents struggle with understanding this particular diagnosis with their children. I've had clients of my own that have actually spoken about how they feel helpless because they don't know what it involves and how it progresses, how they can help their children. So I wanted to have somebody that can come and give us some information and shed some light on it. So Dr. Osei has done extensive research in psychological rehabilitation for young adults with autism. So this obviously goes beyond the childhood stage. So we want to talk about that. And he works hand in hand with other professional service providers and developing the requirement treatment programs, obviously, to alleviate the behavioral disturbances and concerns that are associated with this disorder. He has gotten his PhD in special education from the very prestigious University of Toronto, has done extensive research in neurodevelopmental disorders. He's also been a reviewer of the Journal of Autism and Developmental Disorders, and he is the author of Nature Intervention, a treatment of autism spectrum disorder. Dr. Osei, welcome to the show.
Thank you.
Let's start talking about the book. I'm wondering what led you to speak to this particular diagnosis, the autism spectrum disorder, and in fact, not just to explaining what it is, but providing a treatment for those who want to understand it. And I'm very intrigued by the title, Nature Intervention. So this is an intervention of nature that your book encapsulates, correct?
That's correct. Yes. And I also have another book called Beginning with Brandon's Interest, The Impact of Music and Nature on One Autistic Student's Learning.
Wow.
And it was published in 2010 by Sense Publishers, Amsterdam, Holland. Yeah.
So I understand that you specialize in developing innovative ways so that vocational assessments and rehabilitation intervention programs can be conducted, especially for adults with autism. So it goes beyond the early childhood to the young adults. It also goes into the adulthood and other neurodevelopmental disorders so that they can transition from home to the workplace. So I think that's worth mentioning because obviously you really work with the whole spectrum of individuals that are afflicted with this. And I also forgot to mention that you're also a member of the Ontario Psychological Association. I think that's worth mentioning because very prestigious association. Perhaps we can go to how do you define autism? I know that science defined autism as a spectrum disorder, in particular, a neurological and developmental disorder that affects how people interact with other people, how they communicate, how they learn, how they behave. And although this particular thing, autism, can be diagnosed at any age, it's described as a developmental disorder because symptoms typically appear in the first 2 years of life, so early, very early childhood. And some of the signs are that they don't respond to their name, that they avoid eye contact, they don't smile when you smile at them. I saw this when I was interacting with the son of one of my clients. They get upset if they don't, let's say, like a certain taste or a smell or a sound. They have repetitive movements. And what I've noticed was flapping of the hands, flicking their fingers, rocking back and forth, rocking their body. And they also don't talk as much as other children. How would you, as the foremost expert in this, how would you define autism beyond what science defines it?
Yes, and yeah, thank you very much. And before I start, I also want to say that I have a son with autism
Okay.
who is 30 years old. So that motivated me to do research in autism spectrum disorders and uh, developmental disabilities.
Mhm.
Autism, unfortunately, it affects each individual differently. The behaviors of individual are different. It's not the same. And it is a developmental disorder, meaning that all areas of development are delayed. Some are more severe than others.
Mhm.
And right now, since autism was discovered in 1955 by Leo Kanner, the only generalized or accepted treatment for autism is the ABA technology. So the ABA focuses on behaviors, meaning that if a child has a negative behavior, the clinician try to modify it in such a way that the behavior will improve. But over the years, through research, it has been discovered that after treatment, most children with autism are also in school, especially when they enter school. It has been found out that um, there's a huge gap even after the clinical treatment. There's also a gap between academic achievement and also improved behaviors. For example, you find out that a child has gone through the ABA treatment for, let's say, a year or two,
Mhm.
and has improved in certain areas, social, cognitive, communication, or motor development. But again, you find out that then the academic achievement, there's also a gap, right? Meaning that yes, the behaviors have improved, but his schooling has also been delayed. So now what do we do? What my research has revealed that that's why I brought the nature intervention and treatment for autism spectrum disorders, because the nature intervention also gives parents ways of helping their children to improve in school and at home. Things that you can do naturally, things that are in your natural environment that you can take advantage of, whether at home or the outdoors, right? And I can give you so many examples. My first book, which is Beginning with Brandon's Interest, it showed how Brandon reacted to zoo experience and how animals at the zoo help Brandon to learn names of animals, help Brandon to identify different types of animals, help Brandon to identify nature as a whole, and also the treatment of animals. So all these things, the long run, help him to relate very well with people and also with animals. So I give examples about different ways of moving beyond ABA. That means when the child is in school, what can the parent do to help the child to add more to his skills, to achieve more? A very good example is about what I call the gardens, sensory gardens. For instance, a child with autism can acquire more skills by even at all having a garden for as an example. The child learning how to take care of plants, flowers, and all those things. A child learning how to, I'm talking about a child with autism, teaching the child how to keep plants healthy and all those things. All those skills help the child to use his cognitive skills and apply them in positive ways. Things that can be done with the parent and the child alone, with no clinician um, present. There are so many things, even at home, helping the child to learn how to prepare his or her breakfast, learning how to
Wow.
those kinds. So there are so many treatment opportunities that can be taken advantage of, apart from between the parent and the child, because the child spends a lot of time with the parent more than anybody else.
Very true.
So the parent has to be given the tools to use them so that the child's development can um, can be sustained and improved and and built on. So yes, autism is not a death sentence. Children can get better, but it all depends on the information available.
Right. For the parents to be able to learn about this specific thing for themselves and be able to leverage some of the things that they have available, much like what you described. I'm wondering if for those that would want to be able to implement some of these examples you just gave, like teaching a child how to make their own breakfast or to take care of a garden. And I'm assuming that in the absence of a garden, let's say if they live in an apartment, they could perhaps teach the child to take care of a plant or various plants that sit on the windowsill so that they can learn how to grow a plant from, being small to obviously developing to become a bigger plant. How would a parent teach something of that nature? Let's start with the idea of breakfast. Given the fact that the neurological development of a child with autism is, let's say, not at the same level as that of a normal child, how does a parent communicate? How does a parent teach that particular thing to the child with autism?
Yeah, the parent has so many tools available to him or to her. For example, I start my therapy from from body parts. I think any child with autism must be taught names of his body parts and also the uses of his body parts, because
Okay.
the body is also extends to um, the environment, to the social environment. Because if the child knows the name of, let's say, his mouth,
Mhm.
right, and what the mouth does, right, and the child again knows the name of the hand and what the hand does, then the child can also know that the hand can greet, the hand can say hello, the hand can hold a knife, the hand can butter a bread, the mouth
Right.
is, those kinds of things. So those basic training is very important, especially if you are working with a non-verbal child with autism, because these are the most easiest examples, the things that the child sees every day, things that the child, can identify, can remember, and when he or she is taught, what it does, the child is always in front of the child. The child is part of the child's body. So the
Mhm.
child remembers. It's not abstract, right? The child sees it, the child can use it. So in terms of helping a non-verbal child with autism to develop speech, language, and communication, it starts with the body, right? Once it starts with the body, then it extends to the environment, the social environment. It makes it easy for the child to learn and to apply the knowledge, right? So again, for example, a parent can, take the child to a park close by, right? And see how plants are growing. And also the child will be so happy to know the name of the plant, to see what the plant, how to take care of the plant, right? The beauty of the plant, right? Even if the child doesn't live in the house. So the family can adopt a plant and nurture it And there are so many things that a parent can do to help a child. So again, in terms of teaching an autistic child or training an autistic child to speak, it starts with the immediate environment, things that the child is used to, things that the child wakes up every day and sees, right? Not something far away, right? So it starts with the body, it starts with the environment, it starts with the things that the child enjoys, eats every day. For example, if the child likes cereal, he has to know the name of the cereal. He has to be able to identify the cereal. If it is in a box, he has to be able to identify his favorite cereal from the other, right? Those things make it very easy for the child to develop speech, language, and communication, not something that the child can't identify, the child can't hold, the child can't see, right? For example, if I tell a child, okay, say elephant, and the child can't see the elephant. The child can't touch the elephant. The child can't interact with the elephant, making the therapy more difficult for the child. So always you start with something that the child can see, touch, feel, right? And it's always in the child's environment. Then we extend it to other things, right? So that is what my book does, Nature Intervention, a treatment for autism spectrum disorders. Something that you don't need to buy, something that is in your immediate environment, right? Something that is easy for the child to learn, right?
Mm.
Yeah, because you see, with autism, already there is a delay, right? So you don't want to add on to the child's challenges. You want to break it down, make it very easy for the child to learn and to develop. You want to make the child's environment communication rich, right? Because children with autism, they have to live in an environment where communication is fluid, right? And it's fluid when the child can see it, the child can touch the things that you want him or her to learn. So that is what my book does. And I've given so many examples, right? That parents doesn't have to hire a clinician and pay so much money, right? To things that the parent can, do easily without any training, right? So, so my book, Nature Intervention, a Treatment for Autism Spectrum Disorders, I've given so many examples, even sensory integration challenges, right? I use the sensory garden, right? What is a sensory garden? A sensory garden is a garden that the child feels very comfortable. The child can work in that garden. For instance, if I have a garden and the child has motor development deficit, like fine motor skills challenges, right? The child playing with the sand, right? The child learning how to plant, the child learning how to touch garden tools, right? All the um, improve the fine motor skills, right? So I've given so many examples about how to treat these challenges without um, uh, even getting out of your home, right? So children with autism needs an environment that is predictable, environment that makes sense to them, right? When you are doing therapy with them, when you are teaching them, right? Something that they don't have to think hard or work hard to understand, right? So that is what my book does.
That's amazing. It sounds like you provide parents with a template and a blueprint on how to get started. But I'm wondering, what do parents themselves need to understand to be able to get started on this natural path of helping their children in a way that helps the children understand and integrate things in a way that they can internalize, make sense of it. Like you said, how do parents understand where their children are on the spectrum? Because it's called a spectrum for a reason. I'm sure that it probably starts at a lower level and then it gets to the other end of it, which is a higher level. And the abilities or the development varies.
Yes, it's true. That's why it's called autism spectrum disorder. It is
Right.
spectrum, different levels of deficits. Yes, but there's also one thing that I want to say here, that especially if you look at autism, autism as the disorder uh,
Mhm.
reveals itself. There's one thing that is very common among children or individuals with autism. There's one disorder, there's one delay, deficit that is very common. Maybe about, I would say maybe about 90%
Oh, wow.
of those on the spectrum have is speech, language, and communication delay.
Okay.
It cuts across, right? And I believe through my research and also most of the children that I work with, that I always tell parents that the behaviors that you see, they all have a reason, right? A child with autism wouldn't engage in a behavior without any reason, right? They all have a reason. And because
Right.
the child can't communicate, you think he doesn't have any reason to behave that way. No,
Uh-huh.
that's not how autism works. It has a reason. So if a child, let's say, is very hyperactive, it has a certain reason. Maybe the environment, maybe it is how things are arranged, or the noise, or the lighting system. Or so it's very important that when working with children with autism, um, we also look at speech, language, and communication, making sure that at least even if he's nonverbal, there's a way that communication can be established to give reasons to most of these behaviors that we see, right? So, for example, if the child is, you know, is taken to an environment where he wasn't prepared, you will see a behavior, right? If, for example, if a child is given the same meal, several times, maybe the child doesn't want something different, you will see a behavior. So communication is very important. And that is why I say that I start my therapy with something in the immediate environment, the
Mm.
body, right? Said that I can establish some form of communication, right? For example, if you start with the body, when the child is having pains, having a headache or having pains with his nose or eyes, the child can point to it, right? Some form of a communication, even if the words are not coming, if he cannot speak, right? So communication is very important for all autistic individuals on the spectrum, right? So, one, that is what I want parents to know, right? It is it is very difficult to understand the behaviors if there's no form of communication with the child. Then you have to try and error, try and error. Oh, let's see if this will,
Right.
yeah, and that usually doesn't help, because sometimes you wouldn't find a reason, right? And you see the behaviors over and over and over and over again until, maybe you give up. So communication is very essential. It's very important. And again, effective communication development for children with autism starts from the immediate environment, right? And the second thing too is the school, especially if the child is in school, right? The school is also a very important place for autism treatment. Why am I saying that? Because he's going to meet his peers. The school has a lot of social activities. The
Right.
school has a lot of academic work activity. The school does a lot of communication going on in the school. So it is very important that the child is given the tools to tap into those rich resources at school, right? And that is why I say that in the immediate environment. For instance, if the child knows how to say high five, just think about how many friends that he will get in school by saying high five, right?
Mhm.
Using the hand again the body, right?
Right.
And if the child, you know, can, for instance, knows how to feed himself, just think about how the child can join other friends, to eat. And also, even if it comes to with a lot of children without autism, what I have found out is that from even at age 2, um, toileting skills becomes very difficult for them, right? And if the child understands his body parts, it's very easy to toilet train a child, right? So the body is a very important learning, if I can use the word tool or environment for the child with autism, because the body has a lot of advantages, right? For the child to be able to integrate into the social environment, right? So if the child can get this immediate help, and the child is putting into a social environment, then you have given the child tools to tap into other resources, right? In that environment.
So that's a great place to start for the parents to use the immediate environment
Immediate
to
environment.
be able to communicate to the child, and be able to identify, help them learn how to identify their environment, their body,
Yes.
and how to integrate into their social structures, be they at home, be they in an educational institution, amongst other individuals who may not be on the spectrum. So, just for the knowledge of the audience, how does a parent identify minus without let's say a formal diagnosis from somebody, so once you recognize that your child doesn't have the ability to communicate or be able to be where they should be at their level of neurological development, how do you know when you start these kind of things that you just mentioned, how to keep them and teach them about their immediate environment? How do you know where your child is on the spectrum so that you can help formulate how you start to teach them? What tools do you as the adult, as the parent, use to say, oh, well, my child does not seem to be progressing where at the same level that he or she would be progressing at this juncture? How do they know where they are at? And the reason why I ask is I worked with a woman who had a child, a boy, who was on the spectrum. And she was using at that time, she was using the idea of repetition. So she would say, he does not know how to say the word cookie. So she would hold a cookie in her hand and she would show it to him and she would say cookie. However, it was his speech that was affected. So he was not able to verbalize the word cookie because she would say, what's this? And he was not able to verbalize the word cookie. So she would withhold things from him and try to get him to learn the word cookie through repetition. So that's why I'm asking, how do parents know this would be a great approach versus this? Or in fact, it's better to start here rather than here. With the idea in mind that, oh, well, my child is at 10% on the autism spectrum versus 70 or 75 or 80%.
Yeah, with autism is diagnosed based on 3 main areas:
Hmm.
social, cognitive,
Hmm.
speech, language, and communication, or communication. So social, cognitive, and communication. And any child that shows deficits in two of these three areas is on the spectrum.
I see.
So if you're a parent and you find out that, I'll give you an example on each. If you're a parent and you find out that the child always isolates him or herself from the rest of the family, will probably sit somewhere in the room, doesn't want to be bothered, always for a period of 6 months. You see this behavior continuing, right? That is an example of social deficit, because human beings, we are created to not to be able to be interactive, you know. So if a child always removes him or herself from the rest of the family, then that may be considered, or that should be considered, a red flag. Let me give you another example with cognitive. For example, if a child by, let's say, 2 years, or some children even before that, doesn't know how to eat by himself, doesn't know how to eat. If you put food in front of the child doesn't even know where the food goes, right? That is cognitive deficit. Okay, let's look at communication. If the child can't respond to his name, right? Or if the child, when you call the child, or you want the child to come and get something, the child wouldn't come. That's a form of communication. So if you see these deficits in these areas, so the social, the cognitive, and the communication, a child can have social skills, but not cognitive or communication. That puts the child on the spectrum, right? So 2 out of these 3 areas that I have outlined, right, puts the child on the spectrum. So a parent, those are the things that you have to look for. Even though there are some well-established behaviors that uh, uh, have been identified. For example, eye contact. For example, if the child aggressive behavior, those kinds of things, all these are there. But you look at these 3 areas, and if you find that the child is delayed in 2 or more, then it means the child is on the spectrum. And just quite recently, we look at motor skills, but motor skills, sometimes you still need 2 of the 3 to add to the motor skills to put the child on the spectrum.
So it's 2 out of the 3. So there's, I guess, a checklist of
The
things that
checklist,
you go
yes,
through to identify whether a child is on the spectrum.
exactly.
And the level to which they are deficient in that particular thing would then inform you where they are on the spectrum, to what degree, whether it's very mild or whether it's more severe.
Yes, exactly. For example, if we are looking at social skills,
Mhm.
and you find out that the child always isolates him or herself, and you also find out that the child doesn't show any interest in his or her environment, right? If everything is negative, then it means it's severe. You can find a child who isolates himself but likes music. All these are social indicators, right? You can also see that a child always isolates himself but like certain people in the family, right? When they are there, they will go to them. When they are not there, they will just go and hide at their corner, right? So then you see that it is not that severe, it is mild, but he is still on the spectrum, right? So you may see some social indicators, right? But not all, right? You may see some that are positive, and you may see some that are not positive, or you may see all negative. If it's all negative, and you come to cognitive, and if it's all negative, or let's say majority, about 90% negative, and if you communication, two, if the child is nonverbal, the child doesn't respond to his name. If you show the child his favorite food and the child wouldn't reach out to it, right? All those are communication indicators, right? If the child wants to pee, or if the child wants to poo, and the child wouldn't show any facial sign, right? Or you wouldn't see any signal to communicate to you that the child wants to use the washroom, right? These are all communication indicators, right? So in all these three areas, right, there are lists of signals or signs that the parent must see, right? It goes on and goes on and goes. Some can draw about 100 indicators under social, some about 100 indicators under cognitive. If the child can score, let's say, about 30% of it is positive, then it means it's not that serious compared with a child
Okay.
who uh, can't, you cannot record any positive indicator, right? So that shows that the child is severely delayed. So those are the things.
So, as a parent myself, and you said that you're obviously a parent and your son is autistic, what would precede autism in the sense of what would make a child autistic? Is it, let's say, a nutritional deficiency in the mother while she's pregnant? Is it a trauma? Is it a genetic deviation? What leads to this diagnosis?
Yes, okay. I've done a lot of research into
Hmm.
the cause of autism. And there are several theories that have come up, in the past, maybe I think about 20, 25 years. For instance, I'll give you an example. After 40 birth is one, that some believe that parents over 40 who have
I
children
see.
are more likely to.
Okay.
Yes, that is one. There's also there's also the theory that children who like come from parents who are not sociable, that is Leucan's time, the refrigerated parenting theory, right? That parents who don't come from parents who are not sociable, who are not, don't interact with their neighbors, even, they give birth to those type of children.
I
And
see.
there's also the vaccine theory that some children were vaccinated, when they were young, and that caused delay in their development. There have been several theories that, and also there's a theory too that also came up saying that some parents, when they were pregnant, they had certain conditions, right, that slowed down the development of, their children. So when they had the children, they were delayed, right? But to me, if you ask me what causes autism, I think it is environmental, because there have been studies about the amount of chemicals, hard
Right.
metals in in the bloodstream, right? They've done a lot of research. Recently, they did one in Ghana where I went. I think, I have the studies there. They done a lot of them. In fact, if you read my book, I've made reference to those type of research, that they have found out that some parents, the food, the chemical imbalances in the food chain is a primary cause for high contamination of these heavy metals in the bloodstream, right? And because when the blood is contaminated with heavy metals, it doesn't flow like it should. Therefore, the development of the child is delayed. And that has received, I think, an overwhelming endorsement from researchers across diverse disciplines. Because with environmental theory, and also back up with the tests done on children in terms of the amount of chemicals in their bloodstream and all those things. And also, there have been, even in my own country, Ghana, we have found out that children who lives in areas where the water bodies are polluted, and where there's high concentration of mercury and other things in the soil, right? They've seen that some of these children are born without fingers, some of them are born without good eyesight, those kinds of things. So the
Physical defects, yes.
exactly, birth defects. Yeah. So the environmental research or the theory holds a lot of points to develop why children are delayed in their development. And also, some people have also raised the issue of genetics, right? And we have also found out that, yes, there have been families that have had a child with autism, but it never transcended or it never extended to any person within the family, right? And so all these theories have been challenged, but the environmental one um, hasn't been when compared with the others, has received much more recognition, also understanding, and to challenge it, has been very difficult for researchers. How do you prove that heavy metals in the bloodstream that have proven to cause birth defects can cause developmental delay, right? So the environmental researchers have been able to prove that autism is caused by the disruptions in the food chain and also in the bloodstream, right?
Yes, so that was going to be actually my follow-up question to you. Is autism affected by our environment, our direct environment, or our immediate environment? And in the sense of, let's say, looking at a tribe life versus a city life. I mean, the city life is heavily congested. We are surrounded by the towers that our cell phones connect to. We are surrounded by a lot of pollution in the environment. We are surrounded by, let's say, even the individuals that we interact with, the stressors of life, a lot of cars that obviously pollute the environment through the exhaust, and just the whole idea of the go, go, go lifestyle where you can't even slow down enough to catch your breath. versus in, let's say, more tribal communities, let's say even in the blue zones, where life is much simpler. They are not exposed to as many of the pollutants and toxins that we are exposed to, and especially living in the city. And I'm talking about, of course, post the industrial revolution times, when everything became sort of, food became highly processed and refined, the air became polluted, the water supply became polluted. There's a lot of um, traces of a lot of things like hard drugs, medications, viruses, bacteria, and a whole bunch of other contaminants in the water supply alone. So just that alone, if you are a, let's say, individual who's looking to have a child and you live in that type of environment, I mean, obviously, you're going to internalize that into your organism. And then once you produce the child, those things that have been internalized into your organism will be passed on to the child. And perhaps the brain is not able to handle all those contaminants in its development. So that's why I was asking, are we affected by genetics? Are we affected by the food supply, nutritional deficiencies in the parents' traumas, things of that nature? And I really want to emphasize that, and you, especially as the foremost expert in this, would be able to agree that a lot of the things that we internalize is information. Our DNA contains information, food contains information that we take into the body. And if, let's say, much like a computer, if it's missing something in the coding, then that particular program is not going to be able to run well. And it needs to be fixed, much like how it is with this information that we take into the body prior to procreation. So if we are looking to have children, it's worth investing in really cleaning up your health. And of course, I'm speaking from a nutritionist perspective, being a holistic practitioner myself. Um, I always try to tell everybody that no matter what you want to optimize for, whether it's for an athletic event or whether it's for having children, um, it's very important to detoxify the body, especially in the sense of having children. The body would be the housing for the child, for the life that is to come. And as such, it should be clean enough so that it can develop in a clean environment and have all of the nutrients and everything else that's necessary for the development so that it can develop to its full potential of 100%. So, of course, the environment plays a huge role in that. Um, but what would you say, having done the research, you're obviously at PhD level, far more than the research that I've done and the amount of education I've gotten on this. What do you think has brought the levels of autism to what they are today? So let's say if we were to take the medical system, would you say that autism has always existed and we just started diagnosing it right now through the medical system because we've advanced enough in the medical system, in the technological system and such? Or is this a thing of nature that, let's say, existed before? We just didn't have a name for it, but people would still have children that were deficient in those ways or did have those kind of delayed, um, uh, how would you say it? Neuro Neurological development was delayed. And if that child was to be born in today's day and age, it would be diagnosed with autism. It's just that back then we didn't have that diagnosis at hand to be able to apply it. Would you say that it's just the timing? Would you say it's in the environment, or does everything play a role? So right now it's more or less chance, sort of a depends on where the dice falls.
Yeah, I think you said it right. Autism has always existed,
Hmm.
and is the reason why we are now seeing more cases of autism is one, we are paying more attention to the disorder.
Right.
Secondly, technological advancements. Right? Technology has advanced so much that it's very easy to diagnose, autism from, let's say, ADHD, right?
Exactly.
Um, and also, it's very easy to diagnose autism from, let's say, conduct behavior, right? because of advancement in technology, right? Yes, at first, in the olden days, autism even didn't have a name, right? I think before Leo Kanner, it was called childhood schizophrenia or something like that.
Right.
Yes, autism didn't have a name before Leo Kanner came into the scene. And in the olden days, yes, we dealt with autism, but in the severest forms, right? Because even at that time, the word spectrum didn't even exist.
Right.
What we were paying attention to were things that we could see with our eyes, things that were visible, things that were clear that this child has these challenges, right? But those on the spectrum, we missed them. We didn't know because there was no technology to identify them, right? So I would say that autism had always existed. It's not something that came around only some few years ago. No, it had always existed.
Right, because if you look at the research, it just shows that right now the numbers are through the roof. And of course, you spoke very clearly to some of the theories out there, whether they be vaccine related, or environment related, toxin related, any kind of deficiencies in the parents related. And I'm wondering whether there are some psycho-spiritual aspects, such as traumas or anything that, let's say, would have played a role in what would the person internalize that would be passed on, or would, let's say, affect the genetic makeup of the parents that would then be passed on to the child. So you spoke in the beginning about the foundational principles of the approach that you use in starting treatment for autism. And that's very far from the conventional treatments, I'm sure. I'm wondering if you can speak a little bit to the conventional treatments. If, let's say, a parent was to have a child that has been diagnosed with autism, and they were to take the child to the doctor to say, I don't know, but I don't think my child is progressing well. I look at his peers, and his peers are able to communicate much better than he can. What would the medical system do? Like, what are some of the conventional treatments? Your treatments are by far probably the best ones to start off with, because it's non-invasive. It obviously helps the child be able to socialize and be able to learn things in how to sort of thrive in our world. But what are some of the conventional treatments from the medical industry?
Yes, thank you very much for this question. Because I'm also doing research in that area. I'm looking at the conventional methods, and also I'm looking at child rights and all those things. I'm looking at resistance to treatment, those kinds of things.
Mhm.
For example, if you look at the conventional method of treating autism, right? And you look at for example, the ABA treatment. The the ABA rests on the premise that using punishment and rewards, right,
Mm,
you can get your message across to the child. But with autism, one thing that I have found out is that it is very easy to treat a child if you have the child's consent. Consent doesn't mean that you have to beg the child for the child to listen to you. No. But um, the child has to trust you. That's
yes.
number one. Trust is key, right? So if you use any uh, if you use any punishment, I'm not saying that the punishment and rewards is not, but if you are not careful and the child resists to the methods that you are using, well, you have lost the child. Even if you find progress is temporal, right? And that is why a lot of parents are complaining that, oh, they've taken their child for therapy and yet they are not seeing any progress, right? Because to treat autism, the progress must be sustained.
Of
And how
course.
do you sustain it if the child is not in agreement with your strategy or with your procedure? How do you sustain it? So that is why that is why I came up with a non-evasive, non-intrusive, non-punishment, punishing approach.
Yes. I love that so much. I love that so much.
So, and apart from that, even if I put that aside, we also have to look at child rights, right? Your the child must, a lot of children with autism, especially those with uh, those whose challenges are severe, they see a lot of um, if I can say, violations. They see a lot of disrespect uh, in the treatment process, right? And that makes it very difficult for the child to accept whatever he's receiving, right? So that is why I came up with this book, The Nature, Intervention and Treatment for Autism Spectrum Disorder, because when children come to me at first, and I use the ABA method, I don't see the smile. I don't see the human interaction.
Mhm.
I don't see the responses that I expect to see. I work harder than I should, right? The repetition becomes endless, right? Because you've lost the child in the process. So then I decided that let me set up an environment where it will be more respectful, non-invasive, collaborative, cooperative, right? And will allow me to get my message across and also to be able to sustain the gains that I have made. Because you see, with autism, one thing with autism is that you may be treating a negative at one behavior today. Tomorrow, you will see another negative behavior. So how do you deal with all these challenges in your environment if the child is not with you, or if the child is not agreeing to the treatment that you are providing? So that was my departure from the traditional or conventional method of treating children with autism. And I have treated so many children that are right now, they are in school, they are doing very well. And I remember when I was starting my studies at first, one professor told me that a repeated customer is a satisfied customer. A lot of my children that came to me, I go back, they call me back, for other things, for other services that they need. So, the treatment method has to be respectful, has to be non-invasive, non-intrusive, has to be collaborative, communicative. You have to work in an environment that the child will be comfortable. The child can process the information and you can get the results that you are looking for. Because at the end, it's about sustaining the gain that you have made. If you're going to lose the gain, right? For example, if I ask a child to say dada or daddy, and the child is able to pronounce daddy, and tomorrow the child comes and say daddy, and a week from now the child can't say daddy, I've lost the child. So the gains that you make must be sustained, and sustaining those gains, the environment has to be very collaborative. It has to be very fluid. It has to respectful, right? And unfortunately, I don't see the conventional method as being able to achieve that.
From what you just said, it certainly sounds that your ways of addressing it, much like you said, you said what your professor said to you, which is very the sales, I think, mantra, like a happy customer will always come back. So clearly, if you've been able to help parents help their children, of course, word of mouth would spread, and you would get referrals so that you can help other children. But I absolutely love how you integrate so many aspects of what is important just to human life alone. So non-invasive approaches, collaborative approaches, approaches that take into account children's rights, their ability to function or progress at their own speed, on their own terms, so that they can feel comfortable even opening up to the treatments that you have obviously advised people to use. And obviously the role that environment plays, and nutrition, and every other aspect and facet of life that is integrated in this approach. I think it's so wonderful to see that you are looking at it from a completely different perspective. And it's important that the audience would be able to be open to things, because oftentimes we just turn to, let's say, the medical industry and we put it in their hands. But it's so important to look at how many other things are actually even more important, because looking at the bond between parents and children, we as parents are the first individuals that children bond with. Therefore, we are the first line of trust that they develop with. So they probably have an expectation based on trust and rooted in trust, that we would approach them in a collaborative way, like you said, in a natural way, in a non-invasive way, in a way that's not going to push them past their boundaries, or we would intrude into their space in a way that they don't feel comfortable with. I think those are probably the hallmarks of really being able to treat a child with autism in a way that they would be able to have positive outcomes, benefit from the interventions. Would you say that autism is curable, reversible?
I will no, I will say that if you work with the child collaboratively, if there is respect between the child and the clinician or the educator, and if the child understands the environment, the child can reach very far. The autism symptoms can can improve tremendously, to a point where one can say that he's cured.
I love that so much.
I'm 100%, because I've seen some children, even with my own son, right? all the
You've seen
challenge.
the improvement.
Oh, I want to take this computer there so you see him. Can I do that?
Yes, please.
Okay, just a minute. I'm taking it there so you see. With my own son, he was non-verbal. He failed in all the three domains, but now his social skills is through the roof. Brandon, say hi.
Hi.
Hi, Brandon.
Hi.
Say, how are you?
How are you? Good.
He's listening to his music.
Oh, fantastic. You
Sure,
did speak
yeah.
to the idea that music
Exactly. He's listening to
is
his
therapeutic. Yes.
exactly. So he doesn't want me to disturb him. Yeah, but you see, he has improved. He has shown um, um, a lot of. I will not say that even if I have to assess him in the three domains, his communication is there, his social skills is there. Brandon plays basketball. Brandon will go out for a walk. Brandon will speak with other people. So I will say that about 99% of skills he has gained. Brandon goes to the washroom by himself. He is by himself. Brandon, so all the checklists, if I was assessing him maybe about 25 years ago, I may have all the checklists negative, but now I'll have all of them positive. Maybe, you know what I'm trying to say, right?
Of
So
course.
again, with your question, I think they can be cured. Yes.
Yes, so it's important. I really want to make the audience understand the importance of, because you really emphasize this, the importance of the approach.
Exactly.
The approach is going to determine the
Yeah.
level of success that you will get,
Yes,
so
ma'am.
that, and it's so important, so important, because you as the parent will determine the trajectory of this individual's life, whether they're going to have a quality of life that is higher or lower. We don't want our children to suffer, of course. We want our children to thrive in their environment and in their world. However, I could confidently say that not every child is as lucky to have parents like yourself that would study this particular thing to the depths that you have studied so that you can help them. Um, but in closing, um, Dr. Osei, where can people find you? I think that you are wonderful. I'm definitely going to reach out to my client to let her know about you. She has struggled greatly with the approaches that she's used with her son. Where can people find you? How can they contact you to work with you? I think you have a wonderful approach, and even just for an educational session for the parents to learn how to start, doing things that would benefit their children. Where can they find you? How can they reach out to you to be able to start working with you?
Oh, I will. I think I don't know if I gave you my phone number.
I have your phone number, but I don't
Okay.
feel comfortable letting the audience know. But I'm happy to put it in the show notes if you feel comfortable with
Sure, yeah.
that.
Yeah, sure. And even if my email address is there too, right
Mhm,
now I've set one office up at Innisfail and the Regis one at Vaughan too. I still use there.
mhm,
So I have two locations. And um, if the parent is not close to these two areas, Innisfail or Vaughan, we can use a community center close to them.
mhm,
We just rent, I've done it before, I rent a place.
mhm.
And some parents too will like to home visit. That is also fine.
Yes.
Once they get hold of me, they can arrange with me if they want to come to my Innisfail office. Sure, it's a very large area with swimming pool and everything. If they want to come to Vaughan, It's also where it's an office space that we work. I'll bring all my materials. Like I said, if they want to come to a community center close to them, for instance, somebody may live at Brampton and Vaughan will be far, Innisfil will be far. I can come to the community center close to them. So what they can do is they can, call me 647-518-5492, or they can even call the Regis number, which is 289-859-7676, or they can email me, drawosei@gmail.com. And I think the non-combative, collaborative approach is the best to helping the child to overcome autism.
Absolutely. And everybody, you've just heard, he provided you with his contact information. Please reach out to book an appointment, at least for an educational session, so you have a starting point in addressing or at least trying to help children with autism. And of course, go out there and pick up the book, Nature Intervention, A Treatment of Autism Spectrum Disorder, rich with a lot of interventions that you could start right in your home for free without anything chemical based, everything natural from an individual who has obviously tried and tested all of these with his own son in his own home. And of course, let's not forget PhD level. He has studied this to its very depth. Dr. Osei, thank you very much for the wonderful information they've provided the audience with, for your wisdom, and for all the interventions that you've provided us with so that people can employ.
Yeah. If I can also say one thing, if the audience is interested in finding out how I started with branding from childhood to through schooling, they can also buy Beginning with Brandon's Interest, 2010. I lay down all the processes and how we overcame a lot of challenges, how Brandon was diagnosed right from the start. That book will also help them to learn about how I brought Brandon to where he is now.
Oh, fantastic. So you chronicled exactly the
Yes,
journey.
the
I
journey,
think it's so
beginning with
important.
Brandon's interest. Yes.
Yes. So go
Mhm.
ahead and pick up the book as well, everybody, because you would be able to learn from a person, a PhD, who has been able to chronicle this journey on how he helped his son get from being diagnosed with autism to being a fully functional individual. Dr. Osei, thank you so much. I look
Sure.
forward to perhaps continuing this conversation as the research continues and as you find out things. And please reach out to Dr. Osei if you do want to have a session with him. And stay tuned for the next show. Thank you, everybody.